Mr. Speaker, when it comes to staffing in our schools, Mr. Speaker, I'd remind the member opposite that school divisions make those decisions on how to staff their schools and the supports available, Mr. Speaker. I'd also remind the House, Mr. Speaker, that in June we added $40 million on top of our operating budget to school divisions so that school divisions could make sure to make more investments in classroom supports around class size and complexity to make sure that students in every community are supported, Mr. Speaker. Thank you.
Recognize the member from Saskatchewan Eastview.
What an out-of-touch response from this brand new minister over here. Mr. Speaker, kids can't get the help they need through the healthcare system, and they certainly can't get access to help they need through our schools. Thousands of students added to our school system, but teachers and psychologists have been cut back. It makes no sense. Instead of listening to the member from Sask Rivers, who seems to be the one calling all the shots out of that Premier's office lately, why don't they listen to parents like Sarah? Parents like Sarah, and make sure that vulnerable kids get the support when they need it and where they need it.
Thank you, Mr. Speaker. I move that Bill number 137, the Education Parents' Bill of Rights Amendment Act 2023, be now introduced and read a first time.
Not at all. We do not agree with how the Sask Party is using their majority to ram through what is half-baked legislation in a ham-fisted and undemocratic way, Mr. Speaker. Like I said before, this passing of the legislation in this expedited way is historically used very rarely and in very emergent situations. This government cannot explain to us what the emergency is. In fact, I don't think we've still heard the Premier give an example of when a parent learned about their child using a pronoun at school that they were not happy with.
Do you expect more dead trans kids?
Pardon me?
With this bill passing, does you and your office expect more dead trans kids?
We as a government are working to make sure that we provide support for people for their mental health right across this province, regardless of age, where they live. Again, it's our priority that we're supporting people all across Saskatchewan.
Do you expect the numbers to rise?
Again, I would say that we are working to make sure that we're building upon the supports we have so that people can access mental health supports when they need it and where they need it. I would just repeat that we take this issue very seriously as a government, and we're going to continue to make investments in this very important area for mental health for kids and youth right across our province.
You know, there was many things that went wrong, and the system failed them completely. I'd like to know why, after being removed, they were put on a drug called Prozac, which has one of the highest suicide rates among teenagers. This has been known for decades. Why was there no follow-up for my child? Why did they not monitor to see what was happening, what the effects were on this medication? Why were they not hospitalized after having not 2 ideations but 2 attempts? It's unacceptable. I've seen it happen time and time again. There's not enough beds, there's not enough places, this is what I've been told, and people get turned away to go home and complete suicide, and no one wants to talk about it.